Thursday. The time, you know what, you'll find out that tomorrow for sure. You know, we have shorter weeks now, so we've got to make up some time. So we'll be talking about that tomorrow. And you've been having clinical from what, 6:30 to 5:30? Is that right?
Yes.
I'm assuming that will remain the same, with one exception, and we'll talk about that later. And then, so everything, whatever's on here, and it tells you what to do. Basically, we're going to teach you everything. And then in the afternoon, we're going to do lab skills. So we'll be in the lab in the afternoon finishing up. Okay? It says we'll leave at 5:30. I mean, if we get done, we'll leave early, but we're not supposed to leave early. And the director will be popping out tomorrow. I'm not really sure why, but she told me she's coming, so at least she told me she's coming. So we don't want to do anything too bad. So I think this is where we ended up. We were talking about genetic disorders, and we know how they're communicated. Genetic disorders, of course, are communicated by reproduction, right? If you don't reproduce, we don't reproduce genetic disorders. And then we talked about numbers being the #1 cause of genetic problems, and then translocations. Morning, ladies. And then there's something called multifactorial disorders and teratogens. Does anybody know what the word teratogen means? This is still not It's a toxin or a substance that causes a birth defect. How come that's not working? Displays on, oh, it says to take a mute. That's a silly button to have somebody to push. And so multifactorial, I mean, sometimes, you know, there are just things that happen. And you can't predict them, you can't stop them, you can't even necessarily know about them until birth. And somebody can click the pick mute button, which I've never done, but it seems to be having a little trouble getting out of that. It's blinking. Smart on. Anybody really smart on this thing? I mean, I've pushed every button. No, it's just that the pick mute button is beeping. Clearly the projector's working.
I gotta time it for 25 minutes.
Let's see if I can get that to come off. If your all's phone ring or you get a text message, should I answer it for you?
Yes, please.
Oh, we'll call for assistance.
You want us to put last week's date, where's his date review?
No, you can put it on, whatever.
Today's good?
Hey, Miss Nappy told me something was wrong with this. Hey, good morning. This is Vicki Vaughter, and I'm in room PSCI 110, and I can't get the projector to come on. It looks like someone had pushed the pick mute button, and I can't get that on. I pushed it, and it just blinked, but still the projector is not projecting on the PC.
Yeah, let's do it.
Can you help me? Okay, thanks. Bye.
You need the camera?
Okay, he's coming right over.
Stop my recording.
Yeah, okay. If you want to pause your phone for a moment, that's okay.
Sure. I don't know if the locks or not.
Maybe I have some now. Yeah. Maybe you better come. I don't want to miss it.
I'll grab it on this car. Just plug it in now. Yeah.
All right, well, we can talk about teratogens anyway. So teratogens are something that can cause birth defects. And the category of teratogens can be varied. They can be, as it says up there, you can see, maternal infections. And we're going to talk about maternal infections in the third unit. We talk about complications, and infections can be sexually transmitted, they can be bacterial, they can be viral, so HIV, Hep B, HSV, all of those things could be considered as a teratogen. Also some drugs, medications, and substances. Drugs are rated in category A, B, C, D. A, what kind of drug is in A? Does anybody know? Category A drugs for pregnancy are drugs that have been tested on humans and human pregnant people and have shown no adverse effects. How many do you think are in that category? Like none. Because the only ones that we really, you cannot do that. You can't, at least not in America. We can't say, okay, you pregnant people go and take this drug. Oh, why don't we just be nice when it comes over? Wonder why that did that. Because I didn't touch it. Anyway, and then put the other group over here, you don't take the drug and let's see how your baby turns out. That's not allowed in the United States, okay? In some countries where people have, you know, less lawyers and, you know, less transparency, perhaps. Medications, the only one I can think of right off the top of my head is Accutane, which is a drug that's used for acne, and it definitely is a teratogen, and in fact, women who take that must prove every single month that they are on birth control and they're not pregnant every single month. So if you're a male, it doesn't matter, but the females, they have to do that in order to take the drug. So that's really important. And some substances maybe also. And we don't really know about substances. The NICUs right now are full of substance withdrawing babies, fetuses who've been exposed in utero to legal and illegal substances. But if they're legal, they're usually non-prescribed. We don't really know how much of a substance is okay, how much is not okay. I just heard somebody the other day who is due on July 23rd, so however long, what is she, like 35 weeks maybe now? Her healthcare provider just told her, she's not sleeping well. Well, who does? When you're that pregnant and you're getting up every hour or two at night to go to the bathroom. Nobody's sleeping well, right? Literally told her 4 ounces of wine every night won't hurt you. Go ahead and drink 4 ounces of wine. Well, she asked me what I thought about that. And I said, well, it's pretty contrary to what we see in writing. Usually we say no alcohol consumption is recommended because the real answer is we don't know how much when is going to cause a problem. My personal opinion is probably at 35 weeks, if she has 4 ounces of wine a few times a week, probably it's going to be okay. However, who knows? You don't know. So why would you? I was really shocked. Now, when I had my first baby and I was pregnant in '83, he was born in March of '84, they literally were telling us then, have a glass of wine, put your feet up, relax. That changed around in '85. And then the rule was, the recommendation was no alcohol during pregnancy. Zip, zero, nada. So that sounds good, right? Except remember, 50% of the people who get pregnant have not planned their pregnancy. They may not even know they're pregnant yet, and yet they're having a big time in Ybor for a couple of weekends in a row, right? So that's the problem. The fetuses can be exposed, and the sad part is that's really probably the most vulnerable period of time is during organogenesis. So in the first 72 days of pregnancy. And when we talk about pregnancy, we start at really at the point of the first menstrual period that you last had, so the last menstrual period. So when we say somebody's 4 weeks pregnant, Right now, they'd just be having a period. Literally, only 2 weeks ago did they ovulate and conceive, but we're gonna call them 4 weeks. So a lot of people who are not keeping track of their periods may be a week or two after that. They may have already been growing an embryo inside of them for 4 weeks. Already the spine is developed. Already the heart is developing. We can see at 6 weeks of pregnancy, again, from the first day of the last menstrual period, it came on. It came on and I swear I didn't even touch it. Just all of a sudden, they started pointing and I'm like,
It was me, I switched it.
oh,
It shouldn't do that again.
you
But-
switched it?
Yes, I can control this.
Oh, Lord.
But,
There goes my paranoia again.
I know. How can you do
barely
it
ever
from?
works, I'm surprised it did.
Okay, well, that's
If
cool.
it gives you a blank screen again, try switching to .cam and back to PC.
Okay, okay, I did not do that. It was on laptop, and so I switched from laptop to PC.
Okay. So try switching between .cam and PC,
Okay,
and that usually seems to fix it.
okay,
And if you have any trouble with the computer, let me know, because they formatted it. It shouldn't have been on.
okay. Seems to be okay so far.
Excellent.
Thank you. That was a little funny. So during those first 72 days, you can see on an ultrasound, what I want to tell you, at 6 weeks, you can see a flicker. It's not a 4-chambered heart, but there's a flicker. And I think I have, when we get to an ectopic pregnancy, I have an ultrasound that shows a flicker. It looks like just a dash, really, is what it looks like, but it's the heartbeat. So at 6 weeks, you can see it on the ultrasound. Can you hear it with a Doppler yet? No, but you can see it on ultrasound. So what I'm saying is a whole lot of stuff, important stuff is happening before a lot of people even know they're pregnant. So to say, well, you took a teratogen, you should have known, they didn't know. Now we could say, well, wouldn't it be nice if we were, cognizant of our body and our periods and our cycles, but that's not always the way it happens. And then pollutants. So of course, we have a lot of pollutants. We have pesticides and fertilizers, all right, are pollutant. Fertilizers are great to make things grow, but when they go into the runoff, into the water system and down into the drain into the soil and stuff, they become pollutants. And so food grown from there, water taken from there, and if it's in high concentrations, can cause teratogens. There was a place outside of Boston, I think it was Woburn. Is anybody from that area? I think it was in Woburn. They, years ago, had a tanning factory, where they take leather hides and make them whatever they do to them. And of course, they had all these vats of very, very toxic materials. And whether they knew what they were doing or not, 60 Minutes in the 70s said they knew what they were doing when they buried them under their plants and then vacated. But this area outside of Boston, a town probably about like Plant City, had ginormous levels of childhood leukemias. Compared to any other place in the state and the nation, they were like sky high. So they were all relating it to this toxin that, that they were basically all living on top of. And it had, the factory had been gone for many, many years. So anyway, we don't often know what we're exposed to even. What about those people who still work in the toll booth? What if you're a reproductive person, male or female, and you're working in those toll booths? Now a lot of us, we just zoom by with our little thing. But the ones who are in there, think about all those fumes and stuff. It makes me nauseous. I can hardly give them my money fast enough. So I'm just saying we are exposed to a lot of different toxins. Organic is the new way to go and to eat. There might be something, to that. But you have to get a job to buy organic food, a good job, because it's expensive. Sometimes twice as much. So if you're spending $100 a week on food, you go to pure organic food, you're probably going to spend $200 a week on the same food.
We just had, in Lakeland, where Lakeland Regional, we built, we call it a grassland campus there on Hardin Boulevard, and there was a scare there, and they tested the soil and everything because there were a lot of people around that area, and came back and said our soil was good where we built on, so we were safe, so.
Oh, okay,
So,
yeah.
that-
Unfortunately, people, in order to save money, or maybe just not even knowing, you put it under the ground, out of sight, out of mind, it won't hurt anybody. But if you have a toxic material over years and over time, they begin to leak out of the container that you've stored them in. It's a big deal because we have all this toxic nuclear waste. Well, whose backyard are you going to put that in, right? And how are you going to get it there? What happens to the truck that's driving from here to Louisiana that's going to put it in some remote area and dump all of our toxic material from here in Florida?
Bless you.
Well, a lot of people can be harmed. So there's a lot of stuff to think about, you know, we make a lot of messes for ourselves. Okay. Did we discuss that already? An additional chromosome.
Polly.
Trisomy.
Trisomy, or trisomy is fine. Trisomy or trisomy. If I correct you on a word that you're pronouncing, if there's more than one pronunciation, I'll acknowledge that. If you're absolutely wrong, and I know it, I'm going to correct you, and not to make you feel bad, but I want to tell you how to say it correctly so that you sound smart when you say it the next time. Because lay people mispronounce a lot of words, and when they do that, clearly you know they just didn't Google the voice, you know, on how to say the word. But we should know how to say them. So if I think that it's a word you should know how to say, I'll let you know. But not to hurt your feelings, so please don't think that. So genetic disorders, who do we test, why do we test, and what can be done about genetic disorders? Well, what can be done about them? Once you have one, sometimes, at least in 2017, nothing. There will be, and coming along down the pike, will be some different things, different, you know, high-tech, alien kinds of things where we can do gene therapy, take genes out, or put a gene on a chromosome that corrects the translocation or the boo-boo that happened. But that's not like mainstream. So for now, really, we can prevent. And how can we prevent? By not producing. Okay, that's really the only way. Well, or by using in vitro fertilization and taking out an embryo that has the genetic defect because you've done pre-implantation genetic testing. That's really the only way. Okay, so by not reproducing or not allowing an embryo back in the uterus that has that condition. But there are a lot of the ones that we can early detect. Now that doesn't mean we can do anything about the condition, but some parents who find out about these conditions may choose to terminate. Some may not, okay? Some will accept the gift from God, Buddha, Allah, Mother Nature, Yahweh, no matter what. Others will insist on keeping the child or terminating. Again, it's not our decision, it's up to us to support them, provide them with information and, you know, safe options. You know, it's, yeah, that's it. We can send them for genetic counseling beforehand or even afterwards if you know, so that they know what they're up against. In a regular OBGYN office, when we get back a, you know, a karyotype result that has some sort of abnormality, we can tell them what it is, but I assure you, most offices, unless it's like in a WIC situation where they have social services on site, or not WIC, but like the Genesis Clinic, those people need support. They need counseling, they need more information, and to just send them home to Google what you just told them is really not enough. But in, you know, Dr. Jones's office, Dr. Jones doesn't have somebody in his office that is trained, qualified, or even has time to do that. So we'll refer those people even after the fact for genetic counseling possibly, so that they can get more information or to support groups. Not everybody's a support group kind of person. So for us, it's really, we just gain more information from the patient. How are you feeling about this? What kind of information can I give you? You know, let me help you find your way. And you will find people who will terminate their pregnancies, and you will find people who refuse to have the testing. My own son and his wife refused. They had a 13-week test. I don't even know what it was. I don't know if they did something early or whatever. Came back abnormal. And although it scared me and shocked me, they chose to have no further evaluation. They said when they're 20 weeks, they'll get the ultrasound or whatever, they'll move on, but they were going to make no difference in their decision. And so I said to my son, oh, honey, I really appreciate that. You know, it's really admirable, blah, blah, blah. I said, but, you know, raising a child with disabilities is really difficult and different challenges than you know, it's hard. And he said, I appreciate that, Mom. He said, but as far as I can see, raising a kid is always a challenge. And I'm like,
oh, you raised them right.
I'm like, okay, well, that's a little simplistic, I'm thinking, but that's sweet. You know, so, and you'll meet people like that, and then you'll meet others who will say, oh, no, we're not going with anything abnormal. we don't have time for that, I have other kids, this is what we're going with, and we're not doing it. We're gonna terminate, boom, they're done. So again, our part is to support them, educate them, refer them, get them where they need to be safely, not to make the decision for them, okay? Which can be difficult. So who should receive prenatal diagnostic testing? So testing to see whether they have genetic problems or abnormalities in their pregnancy. There's a long list on page 197 in your book. You can look at it. I think if you look at it, you'll read it and it'll be common sense. But it is a long list. And I do want you to be familiar with it. I picked out a few. Age of parents is really big. Now again, remember, we're offering these screenings. None of them have to take them, okay? But the age of the parent, certainly the age of the mother after age 35, that's advanced maternal age. Somebody told me the other day who was 35 and pregnant said that she's a gorgeous woman. It's her first pregnancy, but she's been called high risk through her pregnancy. This is the same one who was told to drink alcohol. Been told she was high risk because she's AMA. She said she told her doctor the last time she saw them that I appreciate what you're doing and I appreciate that I'm high risk, but I really don't want to hear it every time I'm here. No, she was serious. She said, from my side of the world, I really am happy that you're watching me be extra closely because I'm high risk, but to keep telling me over and over and over I'm advanced maternal age is really not setting well with me. So she was very expressive. I thought that was really nice. So I think it's something we need to know, to recognize it, the beginning of the pregnancy, outline, this is what we're going to do for you. It might be slightly different than another pregnancy you had when you're younger or one your sister had when she was younger, whatever, but because of your age, this is how we're going to handle your pregnancy. And then just go with it. Don't have to tell them we're doing this because you're old. We're doing this because you're old, because they don't like it. Parents are in a high risk group. So if I said to you somebody had a brother with Down syndrome, would you think they were high risk? Yes. So, if they had Tay-Sachs or sickle cell or cystic fibrosis, would you think they were high risk? Yes. What is consanguinity?
If you married a cousin. Sorry.
Yes, it's when close relatives reproduce. And what that does over several generations is it causes a weakness in the DNA strand. And so it's more likely to have genetic abnormalities like not only trisomies, but translocations and things like that. So consanguinity is a bad thing. Consanguinity, a few years ago here in Florida, we were having it with our Black Panthers, I think it was. I went to a conference and the whole thing was about assisted reproductive technology. We had this guy come in and talk about the Panthers in Florida. I thought that was really interesting. Since then, that was about probably 10 years ago. Since then, they're doing better. There are more of them. Because there were so few of them, they had no option other than to mate with relatives, So as humans, we don't do that. Now, in Kentucky and Tennessee, some people do. You marry your cousins. Jeff Foxworthy says, you're a redneck if you go to a family reunion to pick up chicks. Just saying. So,
What's that?
you're a redneck if you go to a family reunion to pick up chicks.
Oh, sorry. I got it.
Now, once you get to your second cousins, the risk is pretty much eliminated, but obviously siblings and first cousins are the most dangerous. So anyway, look down that list, and if I gave you a list, it'd make a great select all that apply question. I don't know if it is or will be, but I'm just saying those are things like that. But I think you won't have to memorize it, okay?
Good.
I think you'll say, oh, I see that.
Yes.
So this is a 3-generation pedigree. Starts with you, or the patient, let's say, and goes out to their siblings, crossways, then up to the parents, and then the maternal and paternal grandparents. When you're a geneticist, we do this. I've had students in the past do this for credit, but we just don't have enough points anymore. But some of those students would tell me that they were quite fascinated by what they found when they asked their grandparents about their medical history and their siblings' medical histories. And they would see things coming down, boom, 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 boom. You could see like hypertension, boom, 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 coming from the family, or breast cancer, boom, 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 or obesity. And somewhere thrown in there, it might go boom, 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 but it might just go bam in the middle, was an alcoholic. I mean, almost everybody had a BAM somewhere, you know?